Good morning, everyone. Welcome to PermanenteDocs Chat. I'm Dr. McDonald. So this week, we're going to be talking a little about global health following last week's World Health Day. And we're excited to welcome Dr. Gingerman, who's done some global disaster medicine and most recently a trip to Ukraine. So we're excited to have this conversation today. So if you have questions, please feel free to drop them in the chat. We want this to be interactive, and we'll just jump right in. We're going to have a high yield of 20-minute questions and answers and a conversation here with Dr. Gingerman. So welcome, Dr. Gingerman. Please go ahead and just tell us kind of who you are and what you do to start off with.
Thanks, Dr. McDonald. So my name is Gingerman. I'm an ER doc. I've been an ER doc for over 20 years. I've been with Permanente Medicine since 2012. I've done some disaster work, although I have to be absolutely open about the fact that there are certainly plenty of other folks who've done a lot more disaster medicine. I started back in Haiti in 2010, and that's probably one of the greatest privileges of my life to have served there. And now when the Ukraine situation had developed in the last 6 weeks, I heard the calling to try to be of service.
That's fantastic. Thank you so much for your service. Take us a step back here and tell us a little bit more about some of your training and how you got involved in disaster medicine, and particularly sort of global disaster medicine, which is obviously very different than maybe disaster medicine in the US. And tell us kind of some of that background and kind of where you got to where you are today.
So I think it's a little bit different now than it used to be a few years ago. There are a fair number of folks who clearly make this a career, who do fellowship training in international medicine, disaster medicine, etc. And I think that's very much called for because we live in a complicated world where people with those types of skills are very much needed. Again, for me, it was literally 2010. I heard what happened in Haiti, and within a couple of days, I was there. I do have to say that I am forever grateful to my partners at that time who jumped in and covered my shifts the same way that my partners at MapMG did this time. I am certified in advanced disaster life support and also tactical EMS, which, as I think our listeners can imagine, is somewhat helpful, if nothing else, to have a certain comfort level when you go into war zones. I would emphasize in both my personal experience and speaking with some of the folks who've deployed to those situations that there's a big difference between disaster deployments and actually sort of conflict zone deployments. I think what's asked of you is different. The pressures are a little bit different. In the end, what you end up doing clinically is quite different, and what your teams look like is very different.
Great, yeah, that makes a lot of sense. Well, tell us more about your experience in Ukraine most recently. How did you hear about it? How do you get involved? And then tell us about just kind of some of what you saw there and some of what you experienced on both a personal and a professional and clinical experience.
Sure. So I guess the first question that I get asked often in the last couple of weeks since I've been back is, like sort of what happened? How did you end up going? How did you decide that it was your turn to go? And all of those things, right? So for me, sort of the simple answer is I'm an ER doc. I have the skills. Folks are suffering. I speak Russian, having been born in the Soviet Union. So how can I possibly not go? That's kind of the simple answer, right? Like you have to be of service when that service is called for. Now, there's also a deeper level for me personally. As a little bit of my family history, both of my grandparents actually were military physicians who served during Second World War and fought the Nazis. So I want to be sort of worthy of that sacrifice and that service. I think that's really, really important. It's also in many ways, I don't mean to sound preachy, but I have two beautiful girls and they're 19 and 17. And I try to talk to them about what's important in life, to talk to them about values. And I think that I can talk all I want about the importance of compassion and kindness But if I don't walk the walk, then it becomes a bunch of platitudes and my messages are empty. So I wanted my girls to know that I was ready to serve. So that was personally very, very important.
Oh, sorry, go ahead.
Go ahead. Go ahead.
I was just going to say that I mean that's amazing to really truly lead by example. A lot of us talk about those skills and that compassion and empathy for all patients, but to actually do it is and put yourself in potentially in harm's way is a whole nother thing. So thank you so much for doing that.
Thank you for saying that. And I think what you just said is actually very, very important. While deployments like this may seem very, very different, I think on balance, they may not be quite as different as we all sometimes think they are. I think the truth of it is, we all know how hard the last couple of years had been, both for us as clinicians and for so many members of our communities. I think it's sometimes very difficult to see the light at the end of the tunnel. I think it gets very, very painful. I think sometimes we feel like no matter how hard we try, we can't make a difference. And I would submit that it's not about how many patients you see or how many bomb raids you have to sit through or whatever that may be. I think it's about finding that one person in front of you and sharing in that, kindness and compassion and that human connection that is real, that is valid, that no one can take away from you. And I think that's honestly, that goes back to the Hippocratic Oath. And that's what we all strive to do. And one of the greatest privileges of my life is to be in a position to be a part of that. It's always the team. That's the other thing. It's never one person, ever.
It's pretty amazing. No matter where you go, what language you speak, what part of the world you're practicing, what type of medicine you're practicing, that human connection is just really so important. And I think that's what I take away from hearing you talk right now is that even in Haiti and Ukraine, in any kind of disaster situation, that human connection and that personal touch of medicine is so valuable. And that makes me feel better when they talk about our jobs being replaced by computers, which is never going to happen because that human touch is so important to medicine. And
Exactly.
that certainly seems universal.
Yeah, no, and I think that again, you go to those places and sometimes you feel like you're not doing enough. And I kind of had a fascinating interaction with actually an older Ukrainian woman. And I was like, look, I kind of feel like we're not seeing enough patients and I'm here and I wish we could do more and all of that kind of stuff, right? And she said something totally magical to me, actually. She goes, you know what? All I care about is that you and your team, a bunch of Americans, loved me enough to drop everything and come here. She's like, I don't care how many of us you see, how many of us you actually physically take care of as clinicians. The fact that you guys are here means that we're seen, means that we matter. And that's all that person cared about. And I thought there was just one uniquely, compassionately gifted individual. But honestly, I kept hearing sort of similar kinds of things throughout my stay. So that was very, very powerful. I mean, I think it sort of gives us something to hang on, to hold on to. I think when we come back here and God forbid there's another COVID wave and again, it gets tough. I think those are the things that we can sort of keep close and focus on. That's what gives us meaning.
Yeah. What types of things, clinically, what types of injuries, like what was it like when you were there? For how long were you in Ukraine, and like what types of injuries or medicine were you practicing for the most part?
So this is actually a very good question because as ER docs, we all want to do crazy stuff, right? I mean, there's a little bit of the adrenaline rush kind of stuff. I think the reality of it is that it depends, right?
Right.
So, I mean, first of all, the vast majority of the NGOs right now are doing work on the Polish side of the border for a variety of reasons. I think most of which are focused on security, right? So, and I think that's a very, very important consideration. I was there, I think we deployed March 7th and I came back on the 24th, if I'm not mistaken. So almost 3 weeks. We initially, went into Poland, practice staged, etc. and then went into Lviv, and really the majority of our work was not necessarily with the folks who were wounded, sort of in the immediate warfare kind of aspect of it, but it was primarily refugees and borders called IDPs, internally displaced people. Mm-hmm. And I think it's important to make the distinction, because when most people think of refugees, I mean, they're the folks who, have to move, and it's very tragic. They have to leave everything, but then they make their way across the Polish border, and in many ways, they're probably in a somewhat, better situation, if that's the right word. The folks who end up on the Ukrainian side of the border are actually, in many ways, in a much more desperate situation, right? Mm-hmm. They still lost everything. They tend to be a little bit lower socioeconomic status, for a variety of reasons that they don't feel like they can cross the border, or it just doesn't work with what their families are going through. So they need a lot of help. And I hate to disappoint the sort of type A ER colleagues of mine. The vast majority of it is actually more primary care oriented, right? It's people who need help with their diabetes, hypertension, heart disease, but also I think a huge part of it is actually psychological care. Yeah. And I think that's not surprising to anyone. I mean, the truth of it is, what can I really do to quote unquote fix the situation for a 50-some-year-old mother whose son is just about to deploy to the front? What can I really say? What kind of medicine can I do? Can I offer to really be of service? And I would suggest that it's not about the medicines, right? Again, it's about knowing exactly where you're supposed to stand, holding that hand, listening as best as you're able, and just, living in that compassion. And honestly, we had an amazing therapist with us on our team, and I learned so much from that individual. I mean, her ability to sort of offer that resilience to people who've been through so much was just breathtaking. And that was very, very inspiring, and a huge part of what we did.
Yeah, that's amazing. I think it's certainly interesting how, as physicians, we have to sort of morph to meet the calling of wherever we are. And as a family physician who practices, primary care, I work in the hospital, I work in the clinic, you sort of evolve and morph into whatever you need, whatever the situation calls for. And I think that's really interesting to hear that, I have some good friends who are doctors who are definitely the adrenaline junkie type. And to hear that there's more primary care needed than anything else in these situations sort of fits with sort of what the expectation is too. So that's fantastic. Again, reminding folks who are on the Zoom, you can drop questions into the Q&A, or those of you streaming from Facebook, you can drop questions in the chat and Facebook as well too. So tell us the logistics of how you go about on these missions. I mean, are there people that if there are physicians out there who want to do some of this global medicine work or disaster medicine work, how do you get involved? I think you went with Team Rubicon, but are there other organizations which do this work where people can kind of get involved who want to learn more rather than sort of doing it on their own, which I imagine is nearly impossible?
Well, so I'm glad that you mentioned the doing it on your own part. So I would honestly highly discourage that approach, because the chances of ending up in a tough situation and potentially becoming a liability for someone, including the American government, especially in a conflict zone, I don't think it's a particularly productive or thoughtful approach. Now, there are obviously multiple NGOs who do this kind of work. And I would also say that for the vast majority of the situations, to expect that suddenly, something horrible like what's going on right now in Ukraine happens, and that you're going to be the first one called if you call an NGO, is probably not realistic, right? So this is something that I think you build towards, both in terms of training for particular skills, establishing those relationships, getting on the volunteer roles of various NGOs. There are a number of those. Most of them specialize in disaster medicine that does not involve deploying to conflict zones. So the number of NGOs that are going to be willing to do something like this and sort of take the risk is going to be much smaller. I mean, I would suggest that actually starting with maybe even like local disaster work in the United States, and actually Team Rubicon does a tremendous amount of that kind of work, is how you sort of establish some of those connections within teams, develop certain skills, develop certain tolerances, right? Learn how to adjust to the environments that are constantly changing so that when the call comes to go to a potentially more unpredictable, more dangerous environment, one can be better prepared. Everyone knows about MSF. MSF certainly is a bit tricky because as much as they do amazing work, most deployments require, 6 to 9 to 12 months commitment, which, for a lot of us with all of our other responsibilities, both personal and taking care of our patients and being a part of Permanente medicine, it gets a little tricky, right? So that's complicated. When I went to Haiti, I went with International Medical Corps, which is also a very established disaster response organization. Obviously, everyone has heard about Partners in Health, Project Hope. There are a variety of names. There are also international organizations like Samaritan Purse right now actually has a hospital in Lviv that is basically full military-style hospital. When I was there, interestingly enough, they didn't have many patients because unless you very clearly establish how is it that you are going to be of service in the local environment, like logistics actually makes a huge role. Unless you have that in place, for a little while, it's a little tricky sort of figuring out what is it that you're going to do tomorrow to be of service. I mean, it's nice to have a beautiful hospital, but you also want to have patients in that hospital.
Right.
And sometimes takes a little while to build that. And the same happened for us, honestly. Took us a few days to kind of figure out those relationships.
Awesome. No, that's great. Thank you so much. Tell us, so for maybe people who would say, there's enough, need in this country, in the United States specifically, why don't you, deal with people here before you start doing more global medicine? What is your response to those people? And how would you also convince maybe someone who isn't interested in doing any kind of, whether it be global or disaster or mission trips or any kind of global medicine, what would you say to them if they say, oh, that's not something we should be doing, or someone who might be on the fence and needs a little bit more convincing? What would you say to them?
Well, so to me, again, those things don't just happen suddenly if you haven't been preparing for them emotionally, mentally, psychologically. I think there's nothing wrong with some people saying, you know what, there's plenty of folks who need our service here, and I'm going to commit myself to the service here. There are also a lot of people, I think, who are very affected by what's going on around the world and wanting to serve there. I don't know that I would necessarily try to convince anyone. We all have a role to play. We're all members of really meaningful, impactful teams. And I think in the end, one of the very basic human needs that we're all looking for is meaning. We all find that meaning differently as long as we are very, very strong in being parts of teams that have that sense of meaning, have that sense of togetherness, have that sense of mission. I'm not sure that going to Ukraine is for everyone or going to Haiti is for everyone. Mm-hmm. Yes, some folks are going to be of greater service in the United States or wherever. We all have our part to play.
That's great. So go where we have meaning, or go where we feel we can have the most impact is what I'm saying, which is fantastic. Exactly. All right, this is fantastic. We could probably go on, but we want to try and keep these short and high yield. Last question. Tell me what makes you most proud to be a Permanente physician.
I actually think that the answer for me is pretty simple. So it is an incredible privilege for any human being, especially for someone who's dedicated his life to trying to heal, to be a part of a mission-driven organization. Every day when I come to work here, I know that every single person there is absolutely focused on doing the best we possibly can for our members, for our communities, but also very importantly for one another. I could not have gone to Ukraine without the incredible support of my colleagues who dropped everything to cover my shift. The gratitude for that will stay with me for the rest of my life. That is what's amazing about this community.
That's awesome. Wonderful. Well, thank you so much for joining us. This is really, really informative. I hope our listeners enjoy this. Make sure if you're watching this on Facebook, you like it, you share it with your friends as well, so we can spread this message farther. It's been wonderful. So thank you so much. Make sure you join us for our next Permanente Docs Chat, which is Thursday, April 21st at noon Pacific. We're going to be talking with Dr. Irwin from the Northwest Permanente Medical Group regarding human health and climate change, which should be a great topic. So thank you, everyone, and happy Thursday or whatever day it is you're watching.